October 18th, 2021 into order. I would like to start off this meeting with a moment of silence as an unhoused man was beaten to death last night out in the 99 area. And we are trying to figure out more information about it, but there's an unfortunate loss that could have been prevented. And I'd like to have a moment of silence. Thank you. With that in mind, I'd like to have introductions of the members of this committee, and please state your name, what jurisdiction or area that you are serving from, and if there's anything that you'd like to share with the group. My name is Chris McAllister. I'm chair of the Poverty and Homelessness Board, and I represent lived experience on the Poverty and Homelessness Board. And I believe I've shared what I need to share. Commissioner Farr.
Thank you, Chair McAllister. Pat Farr, I'm one of the co-vice chairs of the Poverty and Homelessness Board, serve as Lane County Commissioner. The only thing I want to say is this, and I'm going to say it over and over again until he does not hear me say it anymore. Steve Manella, thank you for your many years of intense, progressive, and effective service with Lane County. Your leadership is invaluable, Steve Manella. Thank you very much.
Thanks, Pat.
Do we have another member present?
Sorry, it's my turn to tab. I'll say Mayor Vinnis.
Thank you. Lucy Vinnis, Mayor of Eugene, and just happy to be here. No particular news to share. Thank you so much. But I do second Commissioner Farr's commendation of Steve Manella. We are in his debt for all of the work he has done. So thank you very much again, Steve.
I'll go next. Sean Van Gordon, Mayor of Springfield. And the only thing I just have to let people know is I'm going to have to step away and take a call at 12:30.
Thank you, Mayor Van Gordon, Commissioner Farr, and Mayor Vinnis. I believe that's all of our current members present. I'd like to thank staff and Metro TV for making this work happen. And let's move forward on our agenda. And at the end, if there's anybody who would like to speak in public comment, or if there are any providers who'd like to share news, I'd like to leave space for that. So with no further ado, can we scroll up on the agenda, please? I take that back. Matthias, would you please introduce yourself and if there's anything you'd like to share?
Oh, hi, Matthias Smith, Youth Homeless Representative. And currently there's nothing I'd like to share other than it's kind of cold out and I like it.
Thank you. Welcome. And so I'd like to move forward on the next item. We have the consent agenda. If anybody would like to move forward the agenda or make any changes, this would be the time to do so.
Chair McAllister.
Yes, Commissioner Farr.
I will move the consent agenda for November 18th, 2021. Oh my gosh. What happened to those years?
Can I entertain a second as amended?
I'll second it, Lucy Vinnis.
Thank you. Motion's been moved and seconded. All in favor, please signify by saying aye.
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 Any opposed, signify by saying nay. Hearing none, consent calendar's passed. Thank you very much. We'd like to invite James Ewell from the county.
Good afternoon, everybody. I'm going to share my screen. Oh, can Diana or Amanda, can you allow me to share my screen?
Yep, just give me 1 second.
Yeah.
Are you able to share now?
I think so. Can you all see that?
Mm-hmm.
Cool. All right, well, thanks for having me here. You should have all received this coordinated entry stakeholder charter in your packets. I'm going to cover the highlights of that, but if you're able to review alongside, that'd be great. I can also send out this PowerPoint, you know, as needed. So I think as many of you in this room are aware, you know, Lane County HSD has spent a lot of time in the last year really taking a critical look at coordinated entry in our the coordinated entry system in our county. This has included participation in a nationwide HUD technical assistance cohort, working with several other communities across the country that are also doing coordinated entry improvement work. We've also been actively involved with Community Solutions Built for Zero movement, which is really, you know, picking up steam, I think, in the last 2 to 3 months. We're really excited about that. Additionally, Sarai Johnson has been doing, you know, a really comprehensive mapping of our current system to really help us identify some pain points within our current system that we really need to focus on for improvement. So today, really hopeful that you will approve the charter that was included in your packets regarding the creation of this coordinated entry stakeholder committee. Really, so, you know, to continue to move forward with the efforts that have already begun. So the following slides are really going to highlight some of the key points of that charter, but again, it's all, you know, language that is within that charter. So, you know, the objective of this committee is really to, you know, let me start over. The objective is to create and maintain a committee made up of stakeholders and community partners that are going to focus on advising this board on improvements to the Lane County coordinated entry system. HUD really has identified 4 core elements of coordinated entry: access, standardized assessment, prioritization, and referral. So this committee will really focus on advising the PHB on recommended improvements to those 4 core elements, and then any changes to corresponding policies and procedures that may come from that. You know, additionally, we want to work off the recommendations that were included in the TAC report, you know, some of which were moving to a phased assessment approach within our system, utilizing case conferencing as a way to prioritize vulnerable folks for referral, and utilizing housing navigation more in depth to ensure that the folks that we are referring to housing are prepared to enter into those housing opportunities. Additionally, you know, we're going to utilize, HUD has created a coordinated entry process self-assessment tool, you know, that we really want to use to assess our existing coordinated entry system and further find areas of improvement that were not previously identified, either through TAC recommendations or through the work that we've done within the last year. Additionally, I know some folks on this call are aware of this, but the VI-SPDAT, which is the assessment tool that we have used and that, you know, really the vast majority of communities across the country are using for their coordinated entry, it's been identified to have pretty significant equity issues, both racial and gender equity issues. And in fact, the org code, the creators of the VI-SPDAT back in January, really encouraged communities to stop using it in the way that it was being used. And so this committee, a major goal will be to look at whether or not we want to look into an alternative assessment tool, or if we can adapt the VI-SPDAT to really address those equity issues. And that's really a popular conversation across the country, because a lot of communities are faced with this same issue of needing to take a really critical look at the VI-SPDAT. So membership for this group, you know, voting membership will consist of at least 1 PHB member and at least 2 individuals with lived experience of homelessness, preferably members of League, as well as a minimum of 5 and maximum of 11 additional community representatives and stakeholders. You know, it's really important that we have a diverse representation of stakeholders. Coordinated entry touches, you know, a wide variety of folks within the homeless system. And so it's really important to have vast representation. So, you know, some groups that we have identified so far: shelter stakeholders, permanent supportive housing and rapid rehousing, individuals with lived experience, BIPOC, youth, culturally specific organizations, veterans, domestic violence service providers, intellectual and developmental disability service providers, and then front door assessors that are currently using our system. This is by no means an exhaustive list. We will likely add additional seats, but this is kind of the group that the team that's been working on coordinated entry really initially identified. So hopeful that you all will accept this charter. We're really excited to continue the work in a more formalized way and with engagement from stakeholders. Again, the charter was in your packet, but if there's any questions that you all have specific to this charter or coordinated entry in general, I'm certainly willing to field those questions now.
Looking for a queue. James, I had a RS Self. Wait, RS Self. This is executive meeting. Can you hold your comments for the public comment? Thanks. Thank you. I had a quick question in regards to families. Is there going to be a family seat or a person representing serving families in coordinated entry in this committee?
Yes, thank you for, I can't believe I left that group off there. Yes, that was one of the first groups we identified. So yes, that was an error on my part for not including that. Yeah, definitely will include families, yep.
Excellent. Thank you, sir. Any other members of this body have questions before we move to adopt this charter and have some awesome case coordination happen? Oh, yes, Commissioner Farr.
Thank you, Chair. Just very quickly, James, you mentioned almost in passing that coordinated entry systems historically have had issues with diversity and accepting minority populations. And I'm presuming that there's a high priority as we move forward to make certain that that is consistent with for instance, the county's strategic plan.
Yes, 100%. Yeah, and most specifically, I mean, I think that's seen primarily in the access and then in the assessment. And so specifically that SPDAT piece, the assessment tool needs to needs to take into account equity issues when determining who to prioritize in our community. And so, Lisa Stewart has already taken a real deep dive into our data, and that'll help us to guide those conversations around equity so that we can look at both who is accessing our system, who is served by our system, and then compare the outcomes for a variety of groups within our system. So, yeah,
and thank you for that, James. And Cheryl mentioned this at the Human Services Commission meeting on Monday. Lisa presented the data analytics and the Tableau, all of the information that is contained on the Lane County website. And I'll send that information once again to Diana Aldridge so that every member of this committee can access Lane County's Tableau, which gives in-depth information regarding who is involved and exactly what our history is. It's updated on a monthly basis, so very up-to-date information. Thank you, James, and thank you, Chair.
Thank you, Vice Chair. Madam Mayor.
Yes, thank you. First of all, I just want to say I'm really happy to see this moving forward, and it seems like it's going to lead to great improvements in that system, and so very much appreciate the work on it. I am a little bit curious about the one-year term. Why was it determined that members would serve only a single term as opposed to more, and can they renew repeatedly, and what was the kind of thinking about that?
Yeah, I mean, I think, with coordinated entry improvement, it's going to be an ongoing thing. I don't think we're going to get to a system where we just are like, okay, this is the perfect system and we're done. So, and in addition, HUD really requires that COCs analyze their coordinated entry system each year. So I think the thought behind it was to get a new set of eyes on the system that we create and to reevaluate each year if we need to make changes to that system. I think folks definitely can reapply to continue to be on that committee, but it really was about continuing that improvement process on an ongoing basis.
Okay, good, thank you.
Excellent. Mayor Van Gordon.
I'm comfortable going forward here. I just wanted to comment to that sense of like continuous improvement. It also could be you may just have to break it and rebuild something completely different. And and again, I don't know enough about this to even be dangerous, but I know that one of the things that I always see is like the system is so complex that we keep having to hire people to navigate the system because it's so complex.
Yeah.
And I could be supportive if a committee like this came back and said, you know, we're going to smash part of it and replace it by something completely better because we can't sort of iterate our way to something good.
Sure. Yeah, I think a big part of kind of getting this committee onboarded, well, there are several things that are required for coordinated entry by HUD. So there are things that we cannot get rid of. Those 4 core elements that I mentioned are 4 things that have to be involved. So, you know, oftentimes I know it's frustrating with coordinated entry because folks want to make, you know, like you said, they want to break it and start completely over. There are some foundational pieces that we have to follow. And so because of the technical aspect of coordinated entry, my goal is really to, you know, spend quite a bit of time educating the folks on this committee about those kind of required pieces of coordinated entry and then being able to move forward. 100% agree, though, a simplification of how the system is accessed and how it works and an education to the public on that will be vitally important.
Yeah, and I just want to make one comment here, right? Like, part of this is thinking about long-term and short-term in the same place. Obviously, if there's a HUD regulation in place, that's going to dictate what you can do. But I would continue to sort of just challenge any thinking that says we can't go back and get them to change it, right? Like if we have a barrier as a group, you know, the electeds on this, you know, on this call are asking all the time for examples when we do, you know, annual lobbying for examples to share and sort of, you know, talk to the federal government about what rules are actually impacting us. And Lane County's always been a thought leader in this area, right? So even if you can't fix it tomorrow, right, I would be open for you guys coming back and saying, hey, Sean, Lucy, Pat, when you guys go talk to the feds again, you know, please go talk to them about this.
Yep, definitely. Thank you.
Thank you, Mayor Van Gordon, Mayor Venus, and Commissioner Farr. Amanda has something from Vice Chair Brittany Quick-Warner on this topic.
Yeah, thanks, Chris. So I just wanted to share, I know Brittany couldn't be here today, but was on our prep call for this meeting. And she just wanted to make sure that I communicated around the need for the business community or the chamber to be able to participate in this committee. She was really interested in the topic and any ways that we can incorporate the business community, whether that's in the membership or if they can sit on it as guests or advisory. She really wanted to bring that comment to the meeting. So just putting that on your radar to reach out to her for some more ways for collaboration there.
Yep, definitely. Thank you.
Yes, thank you for that, Amanda and Brittany, by proxy. It seems like there's a lot of support for this. I haven't heard of anything that needs drastic changing. So can we entertain a motion to establish this coordinated entry stakeholder committee? And when would it be effective by, James? When would you want to be populating this?
I mean, I'd like to start, you know, December obviously is difficult. I would love to convene next month if schedule allows. And if because of the holidays, that's not possible, then January at the latest.
Okay, so great. Just trying to think, do you want that incorporated in there to start as soon as possible?
Yes, that sounds good.
Okay. I would like to move that we, oh, sorry, I just saw a message pop up, making sure I'm not missing a point of order. Sarai Johnson mentioned something in the chat. I think this has effect, also reflects this. So she said the next joint elected officials meeting with the City of Eugene Council and Lane County Board of Commissioners is on December 8th. We'll share a comprehensive update on what we've been able to map out so far on it. It's oddly thrilling. We've made some great strides, looking at how we can meet people at their point of need proactively. And by it, she means coordinated entry. So on that note, I'd like to move that we establish the Coordinated Entry Stakeholders Committee effective in December and get this action going.
I'll second.
All in favor, please signify by saying aye.
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 Any opposed signify by saying nay. Hearing none, thank you very much, James. The motion carries.
Awesome. Thank you. Appreciate your time.
Likewise.
You're muted, Chris.
Oh, sorry. Thank you. Do we have now on to winter strategies? Do we have Tim Black in the room? Not hearing that. Can we move on to Sarai Johnson on hazardous weather task force strategy?
Yes, we can. Hello, thank you, Chair and Committee, for having me. The Hazardous Weather Task Force strategy should be one that you're all very well familiar with, since that task force was a result of a recommendation made by the Shelter Stakeholder Committee to this body. And thanks to Commissioner Farr for bringing that to agenda setting and getting that on the board schedule. That Hazardous Weather Task Force has since convened. It's being led by Patience Winningham-Melcher, the county's emergency manager, and she's been able to convene the City of Springfield and City of Eugene emergency managers, as well as other stakeholders, including COAD, community organizations active in disaster, and a variety of different service partners. And before I tell you what we've been doing, I also want to put out a note to anyone involved or interested in this, that we would love to get more of our service providers engaged in this conversation. We have a lot of cool things happening. So the impetus behind this hazardous weather task force was to make sure that we have a clear plan for activating during hazardous weather events, which we of course have year round, and making sure that people who are unsheltered in particular are safe and handled and cared for. So there's an element of this that feeds into emergency management's existing strategy to strengthen their emergency support function 6, ESF 6. Hope I'm not causing anyone to have PTSD from the EOC days at COVID, but I'm doing it anyway. So ESF 6 is a support function under a unified command structure that offers shelter and mass care for vulnerable populations. And in this case, what we're looking at is how do we expand that from a pure sheltering and feeding kind of a mission to a broader based, how do we help people also shelter in place while these events are going on? So there's obviously a lot of challenges with people who are living in tents or in other places not meant for human habitation, to leave their things behind, to get transportation to just manage getting to and from a cooling center or a warming center, depending on the time of year. So this will create sort of an overlay or underlayment, I guess, to our overall community emergency management plans, and we'll have a very specific focus on how do we mobilize and coordinate with various organizations who know how to activate in disasters or who would like to be a part of that effort. The initial step for this group, of course, has been a focus on winter. We had Tim Black at our last meeting. We are also talking about different levels of activation for shelter in place strategies. So finding those points where, we activate for cold weather. Currently, Egan stands up when the weather is 30 degrees or below for a series of days. In this case, for the Hazardous Weather Task Force, we're also looking at what are the slightly higher temps that we might need to deploy supports for people to help them shelter in place and stay warm and avoid hypothermia. So as you may know, Heather Slicky has been good at sharing this piece of information. It's possible for people to get frostbite even when it's 40 degrees but raining. And so that happens here all the time. And it's a real risk for folks, especially those who already have additional challenges health-wise. So that's a big piece of what we're working on, really looking to create better coordination, better communication, and streamline how and when these activations occur so that we know that there's a plan in place ahead of time and that we can always deploy activate and then come back to, in the fun terminology, hot wash it with a review, a debriefing, and making sure that we're improving that response for the next time we do it. So that is all work that's ongoing. We're solidifying and finalizing the temperature activations. I believe it's supposed to be this week, although I think patience is out a little bit. So we'll be getting that soon dialed in, I believe, by the end of November. So that's where we're at. Feel free to join us if you have interest.
Thank you, Sarai. Question, how would organizations join this? Would they reach out to patients? Would they reach out to you?
Either one is just fine. So I'll put patients and patients. So patients is the best person to follow up with. Catherine asked the same question in the chat. So I'm gonna actually just put patience's email in here. And you can email her and she'll get you on the list and send you our base camp, which has all kinds of info in it.
Would this body want to ask any questions of Sarai on this topic? Yes, Mayor Venice, and then Commissioner Farr.
Sarai, this is, welcome news, the work of this committee. And so I thank you for that. I think this is certainly in this body, we've heard this request for this kind of planning and preparation for years. So I'm glad it's finally come. I'm understanding that this is coordination. We continue to have a capacity problem. You haven't said anything.
What do you mean, no look?
And I'm just wondering if there's a part of that conversation.
You get that, so you got the laptop turned
Who's
in.
able to provide and how. Matthias, I think you're not muted and we can hear you.
Whatever works for you.
Oops. Any thoughts on that, Sarai?
Okay.
Yeah, so
I need to get lunch myself.
I don't know if an administrator, oh, there, thanks, Matthias. So yes, great question, Mayor Venice. That is absolutely a concern. You're okay. You're okay, man. So absolutely a concern with every time that we're launching anything or trying to coordinate anything is the reality of our service provider network's capacity. We've clearly asked everyone to really take on more than they ever have in the past over the last 2 years during COVID. And so we are absolutely seeing the edges of that capacity limitation. And that has been true for quite some time now. I think what we're looking for here is how do we help organizations do what they're already doing better and more in a more coordinated way, while also helping to make sure that everyone knows what the plan is when something does occur, including where our center is going to open, whether they're warming or cooling, how often they operate, are they overnight or not, what is our shelter in place strategy, where do you get the supplies that you need for that, whatever it might be, so hand warmers and socks and all that good stuff. So this will be a continuing collaboration with the emergency management departments as well as with our service providers to make sure that all of the right pieces are in place for an activation that's well managed and well coordinated. A lot of this has come out of the experience we had this summer with the heat dome. And in the hot wash we did after that event, we had a lot of conversation around the real solid need for better and more communication, making sure that people know the right place to go for information, making sure we have the right geographic coverage, breadth and depth, to make sure that everyone is getting support and that everyone's not just kind of going to the exact same places with more supplies for the same people, instead making sure everyone who needs help gets it. So it will be hopefully building capacity for organizations while they're already doing the work they're doing, while also providing additional support in these intensive times when they have to meet a really acute need.
Yeah, it just really sounds great. It's the last minute scurrying around. Oh my gosh, we're in a crisis and where do we go now? So I really am very excited about this work. Thank you.
Yes, thank you. Commissioner Farr.
Thanks, Chris. I'm not going to add anything much beyond what Sarai said. And Sarai, thank you for staying on top of this and really being one of the motivating forces in making this happen. It was several weeks ago that I first gave the assignment to Steve Mokrahysky. He's gathered a team and it's moving really post haste. And I think on our November 30th board meeting is when the Board of Commissioners will actually approve the task force at the level that we need to approve it. But the work's being done, and I point out that Sarai has. Man, I'll tell you, Sarai, what's been a blessing for everybody is how many different things you have personally taken on in the last 1.56 years, since COVID began and since everything changed for everybody. And it'd be so difficult for us to navigate, use that term, to have navigated this last couple of years without you doing it. So thank you for that. The second thing I'll mention is also that you've probably heard this, but Patience Winningham, our emergency preparedness director or management professional, was named the Oregon's Emergency Management Professional of the Year. She won the statewide award this last week. So Patience is not here to bask in the warm glow of the accolade, but we'll have a chance to congratulate Patience on that award. It's testimonial, Sarai, to the work that she does in conjunction with the work that you do. The team is what makes that happen. Thank you. Thanks, Chair.
Thank you, Vice Chair. I really appreciate this effort, and it was presented before our Shelter Stakeholders Committee. It went through the process, and now it's starting to yield results right before the winter, and looking forward to see what this does in 2022. Other than the service providers, is there considered membership by staff of the local jurisdictions, or is it simply a provider task force?
This is including emergency managers. We only have our metro area represented on that front, but we do intend this to be a countywide effort. So whether that's something that will likely be bringing on other emergency managers or people who oversee that work in our rural communities, although at this moment, we've really just got kind of our immediate area, mainly because that's where we have service coverage. That said, that doesn't mean that's the only place that people are. We all know that there are people living in all the places in Lane County that there are to stay. And so, yes, and yes, we definitely intend to include outlying areas and other officials and jurisdictions. And ultimately, this recommendation was a whole community approach to hazardous, all hazards, with that whole community sort of lens. And so that will be everywhere. Eventually, it's right now, of course, right here. We'll be expanding that out, I believe, over time.
Awesome. Well, thank you very much on this. If there's not any further questions from this body, then I'd like to move on to Ms. Maria.
You should be able to share, Maria. If you need to share your screen, let me know if you can't.
Thank you.
Thank you, Maria.
Okay, hopefully everybody can see my screen.
Mm-hmm.
Right, well, hello everybody, my name is Maria Cortez and I am the new Shelter Program Service Coordinator for Lane County Human Services. And I'm gonna talk to you all a little bit about the winter shelter investment out of the cold funds. And this is a third wave of funds. We received 2 waves last winter. And I know I'm preaching to the choir a little bit when I talk about scope of need. I think we're all pretty well aware of the need, but there were 3,754 people actively experiencing homelessness here as of October. And there were 856 shelter beds in Lane County, both emergency and alternative shelters such as Conestoga huts and pallets. I wanted to just touch on the need in regard to the COVID emergency Motel program. So this is a program that started about a year ago and really prioritizes folks who are more susceptible to complications from COVID-19. And there are about 113 beds, and there are currently 503 individuals on that wait list. So it just kind of gives you an idea of how many people are really needing to get into shelter. And keep in mind that these are folks who are, you know, the most medically fragile and, you know, over the age of 65. There have been 1,074 total applications for that program since it began. A little bit about the Out of the Cold funds and where they came from. So earlier this year, 10 million in state general funds were allocated through House Bill 5011. And of this 10 million, 1.1 million have been allocated to Lane County Health and Human Services. And really, that is to support infrastructure operation and services to emergency shelters. There are 6 areas that we can look at providing funding for. So street outreach is one of them. So looking at, you know, kind of case management, so to speak, reaching out to individuals who are out on the street and providing those needed services, connecting people to shelter, to housing, and other services that are needed. Emergency and transitional shelter operations is another area. And for this portion, we can think of this pretty creatively in kind of getting away from just a traditional emergency shelter model and looking at alternatives such as structured campsites and things of that nature. Shelter resident financial assistance is another area we can look at providing funding to individuals for things like first and last month's rent, paying for ID, transportation, other things that would be barriers to folks, you know, from being able to access shelter or housing, acquisition of freestanding structures such as pallet shelters and or conestogas. That's another option, as well as the rehabilitation or conversion of shelter facilities and data collection. So one of the key requirements of this funding source is to partner with culturally specific organizations and or federally recognized tribal governments. So some of the things that Lane County is currently doing to address equity is, so earlier this year, we adopted a new strategic plan for health and human services. And one of the major goals is to promote equity and decrease disparities. So HNHS is now employing an equity lens. So looking at how, you know, how decisions are made and policies are created and making sure to include equity in that, as well as increasing outreach, engagement, and access to marginalized communities. Earlier this year, this board voted to include an equity framework within the RFP process. So looking at groups, organizations that we are working with and ensuring that there is equity and they're being assessed for equity within their programs and program structures. Previously, we have partnered with organizations such as Central Latino and the NAACP to support COVID efforts. So Central Latino has been key in getting out rent assistance to the community, and the NAACP has been key in collaborating on vaccine clinics. Moving forward, really, we're starting to talk about increasing access to shelter for unhoused folks who are part of culturally specific groups, and just beginning to really have those conversations and look to addressing that in the future. April 30th, 2022 is the deadline to spend these funds. And so as you all know, that's right around the corner. There are 4 funding priorities that we've identified. So one is to maintain shelter operations. So just looking at what our current inventory is, what we're already doing and how we can continue to support those operations, as well as potentially enhance those operations where those opportunities present themselves. And then also looking to support winter warming strategies in general. and, talking about things like, emergency warming sites in both the urban areas as well as the rural areas. And then also, like Soraya mentioned, sheltering in place and what that looks like. Services to alternative shelters. So we are in conversation with City of Eugene in discussion about the safe sleep sites and how we can look to support those sites moving forward. And also the pallet shelter expansion. So we have also received an allocation of ARPA funds that are earmarked specifically for pallet shelters, so $750,000. And we're looking to, out of the cold funds, to sort of supplement some of those associated costs like setup and logistics. So here I've just laid out kind of, those priority areas and what we are estimating the allocation will look like. Again, these are estimates, these are going to change. We are still in the process of determining how these funds will be spent. But again, shelter operations and looking to expand and maintain existing shelter, looking at winter warming, supporting winter warming sites and shelter in place strategies, things of that nature. Also supporting alternative shelter, such as safe sleep sites, and the pallet shelter setup and logistics. So moving forward, some of the things that we're doing currently, we've been reaching out to community-based organizations, giving a needs assessment and really just gathering as much information as possible in regard to what the overall need is in the community and what the capacity is as well. As we all know, there are a lot of staffing issues in the community. So there are a lot of, there are things there that we have to take into consideration. Also evaluating current contracts. So looking at those folks who we're currently contracted with and what those current operations look like and how those could be potentially enhanced to support more people. Also finishing up, we're going to be finishing up the allocation plan by the end of November. This is a requirement of this funding, so very quick turnaround time for all of this. And so we are planning to have that finished by the 30th. Also, any new projects that come up, we are ensuring that we are going through a fair and equitable procurement process. And if we do have balances after this allocation plan is laid out, we certainly plan to consult with shelter stakeholders to determine what that need is. And I am open to questions.
Well, thank you very much, Maria, for this presentation. I'm really excited about the options that are coming in for winter prep. I understand that some of the pallet structures have kind of had a leak problem. I was curious if any of these dollars might be able to put canopies or something over the pallet structures. That was one of the only complaints I could figure out, because other than that, these are warm beds. These have electric. They have closed doors that lock. So I'm really a fan of the technology. Just want to make sure that they can withstand the winter.
Yeah, Chris, thanks for bringing that up. That hasn't specifically been brought to my attention yet, but that is something that I will definitely keep in mind as we're moving forward and thinking about pallets and how to sustain those over time.
Awesome, thank you. Is there any other questions from members of this body? Yes, I have Commissioner Farr and then Mayor Venus.
Thank you, and thanks, Mayor Venus, for stepping in after me, but you're welcome to speak ahead of me if you wish to. Okay, thanks. Maria, you and I have not met face to face yet, but thank you for assuming this role, this job. It's a big job. You knew that when you stepped into it, and right now a lot of things are happening almost like fire hose intensity. I'm sure you're feeling that, but you made a good report on what is happening and what we are doing at the county level. And one of the most important things that you're aware of, I know, is that coordination with the city so that our resources are used in the same direction at all times. I'm sensing more and more of that on a regular basis. City of Eugene has been very active in establishing geographic areas, spaces for people to actually whether it be park their campers or in some cases simply pitch a tent. I conducted a tour of county commissioners yesterday. This week is AOC week, where all the counties from Oregon are in Eugene for our meeting. And we toured a number of facilities, including, we did not go to Springfield, but we toured the City of Eugene facilities, as well as the community supported shelters and Square One villages. And nothing even close to what we are doing here in Lane County is being done elsewhere. And they're taking examples of some of the things that you talked about. For instance, when Dan Bryant was talking about our pallet shelters, he was absolutely effusive in his praise for the fact that the county has stepped forward and put those out, and they were adding more of them. Now, a question that I have that you may or may not have an answer to, and I'm going to go on before I receive the answer to the question, is regarding the UL approval of the electrical portion of the pallet shelters. Inside the City of Eugene, I think we've had some difficulty actually plugging them in. So an update on that if you can, or we'll talk about that a little bit later. But also, Chris McAllister and everybody listening, something you and I have talked about. Generally speaking, the people who are operating shelters like community supported shelters, or Carry It Forward for that matter, in many ways like a Conestoga over the pallet shelter. The pallet shelter offers more space and it does offer heating, but the Conestogas are a little bit more stout, and they also have insulation. So just to bear in mind that as we move forward, the county is investing in pallet shelters. We're getting more pallet shelters, but it does not rule out the fact that we'll continue to use Conestogas and other types of shelters that are being manufactured here locally. So thanks for all the work, Maria. Just the start of some intense effort as we're coordinating with the cities through the winter. Thank you very much. So if you have an answer on the UL approval, provided. If not, don't be embarrassed that you don't, because I don't have one.
Yeah, so I do not have an answer on that yet. So I've been in this position about 4 weeks now. I've been gathering a lot of information, and that is one of the issues that I heard existed in the initial process of setup last year. So it's something that's on my radar to look into as we are really hashing out our plan for where these pallet shelters are going to go and site setup. So that is on my to-do list.
Thank you, Mayor Vinnis.
Yeah, thank you so much, Maria. Thank you for your work on this, and thank you for a very clear and succinct presentation. And I just have a couple of clarifying questions. So you mentioned in your opening data that there were 3,754 homeless this year through October. And when we did the homeless by name count, was it the year before, the number for the annual was over 9,000. So I'm just wondering about that dramatic shift in numbers. And Steve put his head up, so he probably also has a thought on that.
So this is the monthly number, not the annual.
Oh, okay, gotcha.
Yes.
Sorry. Okay, I misheard that. That makes.
It was October.
It was for October, not the year through October. God,
Right.
Thank you.
Right.
I misheard that. So thank you. That clarifies that, because I knew it was a big number. The other thing is that in your description of the key components of the House bill that provided this funding, you gave 6 or 7 ways in which those funds could be spent. And I'm understanding that the strategic decision was that they would all be spent on that second category of emergency and transitional shelter. It seems as if your kind of 4 goals all more or less fall into that category. And I'm fine with that. It's very clear to me, and I've said it to this body many times about the enormous need we have for street outreach, but I'm also recognizing winter is coming and you have a short time frame. But I don't know if you could speak to that, about that choice of directing the funds.
Yeah, so great question. I think that we are looking at all factors in terms of the sustainability of the funding and how that branches into other streams of funding. And so we've certainly had conversations around outreach and whether or not that would make sense. And we're also sort of talking about acquisition. We're not quite sure yet, because we're looking at those ARPA funds and for pallets, but then there are other factors like there are bathroom and shower facilities that we could also purchase. So we are kind of toying around with that,
Okay.
but it's not set in stone yet.
So I can speak to the House bill, and so this House bill provided for 25 million, and so 10 million of it is being used for out of the cold, and then another 5 million is going to be used for the turnkey projects like Bridges on Broadway, our turnkey project, and then the state hopes to put out a RFP early next year to support navigation centers that were in other legislation. And that's overall how the money is being spent. The other consideration that we've had in looking at programming these funds is that these funds are available between now and April. And the funding that we're using for outreach, we're trying to sustain that funding for a longer period of time. So we're choosing to use other funding for that. One area that Maria didn't go into in depth is that we are looking at the ability to do some bulk purchasing, which means buying things like tents, sleeping bags, those sorts of things, and then having delivery drop to local nonprofits that are working on that. And that's where it may span the boundary of both shelter and outreach, and in programs being able to use those supplies. So we can use this money to make bulk purchases of those sorts of things for this winter.
That sounds great. Thank you. Thank you for that explanation.
Yes, thank you everybody for this. We now have Sarai Johnson on navigation strategies.
I'm back. Thank you, Chair and Poverty and Homelessness Board. So navigation strategies is something that we've been looking at for the last year as a way to focus. So as you all remember, last year at this time, we were really going really hard and heavy on our winter strategies, in particular, standing up as many non-congregate options as possible as we entered into that first winter with COVID-19 before vaccinations and all of that good stuff. So we, at that time, looked at how do we build up this network toward the goals that we have as which is to increase the ability for people to navigate from being unsheltered all the way to being housed, and looking at any point of contact as an opportunity to help those folks get where they want to go. My internet is weird. Is anyone experiencing that? Can you all hear me okay? I'm gonna keep talking until somebody tells me.
You're fine, Sarai. You're coming through fine.
Okay. Great, thank you. Anyway, I'll ignore all these upcoming little notifications then. So that's what we focused on last year, is we were looking at how to stand up the shelter operations and services to make sure that we were able to help connect people to the resources available to them. A little bit earlier, you heard James talk about the coordinated entry project. And so one of the big things that I think is key to improving how the system works and improving how we help people navigate from being unsheltered or unhoused into permanent housing is to use our coordinated entry system to meet people at the point of need, including when they're feeling like they're not sure about their housing stability, when they've received an eviction notice, whether if they've been unhoused for a period of time, so that they can go to a simple, easy access point, whether it's by phone or online or in person, to get the supports that they need. So coordinated entry is going to be a big part of this. And of course, as you all know, we're also working at this time on the Navigation Center, which is very specifically a 75-bed low barrier shelter that's meant to help people navigate into permanent housing as quickly as they personally can. So the services at that center will be aimed toward helping people remove barriers to housing, whether that's document retrieval or supporting them, increasing their income in a variety of ways. and so forth. So all of those pieces are falling into place along, like kind of along the spine of coordinated entry is sort of how I'm thinking about it. And then the rest of it sort of connecting into how that system is going to look. So hopefully a part of that has been looking at our shelter system as it is, who's serving who, where our shelters are located, and so forth. And then other parts of that are going to continue more in depth as we build out coordinated entry and as we build the navigation center itself, start operating it, see how it works, how it doesn't work, where are our bottlenecks. There are a lot of places that I think we all can agree we're anticipating we will experience some of those, especially when it comes to housing stock. We all know we have a very low vacancy rate in our communities in Lane County and Eugene and Springfield as well. And so we want to look at how all of this is starting to work together, where we find blockages, and then how do we remove those barriers to other people's housing. So that is all in the works right now. It continues on. Again, just to reiterate what James said, really encourage y'all to get involved with the coordinated entry project if this is something of interest to you. And to highlight and tell all your friends, please, that the Navigation Center Services RFP is currently up. The applications or proposals are due on December 3rd. And if you have any ideas about how you or your organization would propose to run a navigation center or a part of it, we would really love to see what you're thinking and what you have to offer. And we're looking forward to getting that program off the ground.
Excellent. Thank you very much, Sarai. Are there any questions from this body or comments from this body regarding the Navigation Center? I just want to say thank you very much for the county staff, both in securing this building, using strategic spending, and being able to focus a lot of this towards not only just the goals of the strategic plan, but the greater community needs. So special thanks to Sarai and Steve Manella and Danielle Batista, Amanda Borda, all the staff who are making this happen. So, and James Yule as well with the navigation component. If there's any questions about this, feel free to reach out to Sarai, or if you have any more comments on it. So thank you, Sarai. Is there anything else you would like to mention on this before we move on to our next topic?
Yes, I just have one really super quick thing, which is that just to clarify, this is a joint project between City of Eugene and Lane County. So city staff is also working very closely on this project, including Brooke Freed and Reagan Watchus primarily. So want to make sure that's clear that the city and the county are really well partnered on this project and continue to work toward making the building happen and then sharing the operation of that as well.
Yes, thank you very much. I don't see the city side as much, so I do appreciate you recognizing it and highlighting it. So thank you again. And speaking of city, I'd like to invite Peter Chavan to talk about safe sleeping sites.
Thank you, Chair. Thank you, committee members. So my name is Peter Chavan. I work in the city manager's office and manage the homeless programs that the city operates. And I appreciate the opportunity to give you all an update on our safe sleep sites. So as most of you probably know, the city has been working for the past several months to stand up safe sleep sites to help stabilize folks who are living outside. The city has been partnering with Lane County on the deployment of these sites, whereby the city has been funding the infrastructure development, so ground prep, structures, making sure the sites have water, electricity, and sanitation, as well as site management, so intake, site security, resident policies and procedures, and general site facilitation. As you heard a little bit from both Steve and Danielle, the county is negotiating with providers to add services to these sites, so medical, mental, and behavioral health, housing navigation, basic needs supplies, and the like. So as sites come online, we're grateful for the partnership with the county to make sure that people living in these new sites have access to services. The first site that we've opened is at 310 Garfield, which is the city is leasing from LTD. It opened on October 4th and has a capacity of 55 vehicles and is operated by St. Vincent de Paul. That site is currently full and has an extended waiting list. We've been hearing throughout this meeting how dire the need is for shelter, and we saw it when we opened 310. It was filled pretty quickly, and the waiting list continues to grow. We have 2 additional sites approved by council that we are hopeful will come online before the end of the year. 410 Garfield is a piece of property, a warehouse that we're leasing from a private entity that also will be operated by St. Vincent de Paul. It has a capacity for 86 tents inside the building and a yet to be determined number of RVs and pallet shelters outside the building. St. Vincent had the opportunity to explore a new type of structure. It kind of landed at 410, and we're trying to figure out how that affects our site plan. So we're not sure exactly what the capacity will be outside of the building, but we do know we'll have some space for vehicles and some sort of structure outside. So we hope that will be open before the end of the year. A second site that we're hopeful will open before the end of the year is at 1250 Bailey Hill. This is interesting. It's a piece of property owned by Arlen Rexius, who has leased it to Everyone Village at no cost for 5 years. So that's a really dynamic example of the private sector stepping into this context and taking an active and productive role. So I wish Brittany was here to hear us say that. So this site, it has a capacity for 17 RVs and 15 structures. Those might be pallet shelters, they might be Conestoga huts, and there are a number of innovative builds that are happening in our community. They haven't decided on what specific structure they'll be using, but they're anticipating capacity for 15 people who were formerly living in tents at that location. Early in the, so with those 3 sites that I've just mentioned, we're optimistic that we will have added 100 alternative tent locations and 75 to 80 additional vehicle locations. And this on top of the 100 additional alternative shelter beds the city stood up over the past year through our Rest Stop program. So the city has been, feels like a scramble on the inside, trying to expand opportunities for people to have a more stable living environment. So in addition to those sites, we are also working with Square One Villages to open what we're calling the Rosa site at the corner of Bethel Drive and Roosevelt Boulevard. That's a piece of property owned by Square One Villages. And they will be the primary contractee for operations, although they are in conversation with other providers to partner on the operation at that site. That site would add an additional capacity for 40 structures, could be some combination of pallet shelters and Conestoga huts. So those are the sites that we're working on actively currently. Council has also approved a small safe sleep site at Chase Commons Park. That one is on hold for the time being. We have not been able to identify an operator for this location yet, but that has been approved. And once we get these other sites completed and deployed, we'll be able to turn our attention to Chase Commons. In addition to these sites, the city is continuing to look for locations as well as explore with providers ways to increase capacity to operate sites. So there's a quick update on safe sleep sites, and I'm happy to answer any questions folks may have.
Are there any questions from this body? I see Pat's currently excused. I just want to say thank you, Peter, for presenting this. I know that there's a lot of traction needed to move things forward, and y'all have been very diligent trying to get both sites available as well as community partners engaged. So thank you to you and Reagan and Brooke for trying to push this forward. 500 is an ambitious number, and I like ambitious numbers. It's not 3,600, which is what I led with. So we're doing what we can, and the more successes we have, the better we can help cultivate this. So every bit matters. Yes, Commissioner Farr.
Thanks, Chris. I was here the whole time. Somebody knocked on my door. Apologize for that, Peter. I was listening, but I just wanted to point out that I mentioned a tour that Dan Bryant helped me to facilitate yesterday, and beyond Square One Villages, we did happen to stop by, as I mentioned earlier, some of the sites that the city of Eugene has chartered and is operating, and it's very impressive. There were commissioners from, I believe it was 5 different counties, as well as staff that participated, and nobody else is really doing anything quite like it once again, but they all were inspired by what the city of Eugene is doing on what seems to them like short notice in a relatively well located, in a great location that really is. They were particularly impressed, Peter, with the, first off, we drove by Washington Jefferson Street, and they said, well, where's the trash? Well, it's taken care of. It's required to be taken care of, as well as sanitation and toiletries, etc. And the same thing with the sites out on Garfield, the site out on Garfield in particular. So I just wanted to extend just congratulations and well done. It is really it's inspirational, not just to us here in Lane County, but throughout the state, based on observation from other county commissioners yesterday. So superb.
I appreciate that, Pat.
Excellent. Well, thank you, Peter, for your updates, and we look forward to checking with you maybe next month or in January, depending on how things are going.
Just give me the word.
Yes, sir. Thank you. Moving forward on to our second to last item, county updates. James, would you like to speak to outreach efforts?
Yep. Again,
we have approximately 10 minutes for this item.
Okay. I believe I'm just taking a portion of this, and then Steve will take the rest. But so
yes.
Quick update on street outreach efforts. So we have continued our current outreach efforts over the last several months. Full geographic coverage of Lane County is happening via street outreach. We have a contract with Carry It Forward, and they are handling East and South Lane County outreach. And then we have a team of HSD staff that handle the West and North. And we had some staffing issues with that team, as I think all providers are feeling staffing issues right now. But since September, we've been back to being able to do full outreach out in Florence, Veneta, Coburg, and Junction City. Continue to have our contract with HIV Alliance for the health-focused outreach team. They're able to go out and do mobile medical care in the field for folks. And then our coordinated entry outreach team, although it's not a traditional street outreach team, they work closely with folks that are on the coordinated entry waitlist to ensure that they will be prepared for referral when a housing spot comes open for them. And then additionally, we have our rapid resolution diversion team through Shelter Care. Again, not traditional street outreach, but they really work to engage folks that have found themselves newly homeless, or folks that anticipate becoming homeless soon, and they can really help to rapidly resolve their homelessness or divert them out of the homeless system by accessing family supports or other resources that they may just need help with connecting to not become homeless. Additionally, I'm excited about a partnership with City of Eugene, about a Metro Eugene street outreach team. We're finalizing the details of that contract with a provider right now, and really excited to get that up and running soon. Also have been in conversations recently with Springfield about a Metro-based Springfield street outreach team. And so again, very excited about the things that are coming up in regards to street outreach. Additionally, just quickly wanted to mention, for the last 2 months or so, we've been hosting a bi-weekly case conferencing meeting with street outreach providers, all the ones mentioned previously, as well as a variety of other providers in our community that are conducting street outreach, and really utilizing those meetings to help identify the highest vulnerability folks on the street, and how we can best serve them as a network of outreach providers, and not duplicate outreach services in any part of the county. So excited about that case conferencing effort as well. That's all I got for street outreach. I think Steve is going to touch on some other updates.
Thank you, James.
Before I begin, are there any questions of James, what he presented? Okay, thank you all. So I'm going to report on a slice of the American Rescue Plan dollars that Lane County has received through the state of Oregon. And to give you some background, Lane County and Alex Kyler, our intergovernmental relations manager, worked with legislators to help shepherd 22 proposals that got funded as a part of the budget from the state with federal ARPA funds. And so the ones that I'm going to mention today are just the ones that are coming through our office to be managed, but I'll mention some others that that I know of as well. But the first one on the list, and all of these I included in the packet. There are copies, one-page synopsis of each of the projects that we turned into the state of Oregon. So at your leisure, you can look at those. The first one is $1.5 million for land acquisition to place either pallet shelters or some other types of alternative shelter structures in Springfield, and then eventually use the purchase of that property to develop it for either permanent supportive housing or affordable housing or for a mental health crisis center. The second one is the Maria mentioned earlier, Senator Beyer had put into the bill $750,000 for purchase of additional pallet shelters. And I just wanted to mention that the issue around the durability of the pallet shelters that was mentioned earlier. Pallet shelters are really designed to be deployed and set up on a flat surface like a parking lot, and not to be moved around. And the issue that was raised about the water leak, what has happened here with our first 120 is that we had several situations where we moved pallet shelters, and so they don't do well with their structural integrity if they are moved often. And that's the issue with the pallet shelters. Otherwise they're very good. So that's one of the things we have to look at as we deploy additional pallet shelters, to say, we're gonna deploy it, and similar to what the city of Eugene is doing with the safe sleep sites, we need to be able to say, they're gonna be there for the next 2 years, rather than, what we've run into is a church sponsor saying, well, the church members are coming back to church, could you please come and pick these up and deliver them elsewhere to another group to use. We have $100,000 that was forwarded by Representative Nathanson for nonprofit capacity building, which a lot of the discussion around that has been around the human resource capacity in the current environment. $75,000 to start a landlord engagement program. $500,000 for our Brickland Street shelter that was formerly the Schenkel Safe Haven, and most of the work on that has been done, and we're looking forward to reopening that building for another purpose after the first of the year. And I think at the last meeting, you heard from Amanda Borta, who shared some of the plans for that. And then $400,000 for mobile crisis response vehicles. And this is separate from money specifically for Cahoots in Eugene. But this also includes some money to purchase outreach vehicles for homeless outreach, to be able to bring supplies out to the field as people are in the field. And often that requires a vehicle that's, a little larger than a sedan to be efficient in hauling those supplies. So that's those projects total a little over 3.3 million. And we're very glad to have them. Another discussion has been the ARPA funds that the city of Eugene and Lane County and Springfield have received. And, we're very hopeful that we'll have more information on that in December. I know the county board and the city council are going to be receiving recommendations from staff and, getting input from the public on the allocation of the dollars that came to the cities and the counties during the month of December. So that is that one. Are there any questions on any of these ARPA allocations?
Commissioner Farr.
Hi, Steve. A good presentation as always. You crammed a lot of information into a very short period of time. Just a quick question regarding pallet structures and pallet shelters. There is a pallet shower house that's available.
Yes.
Have we looked into that, and is that something that we may have in the pipeline?
Yes. Yeah. And Maria has that on her list. So we're looking at, they have the shower and bathroom units. They also have what are considered to be sort of kitchen area, food preparation units that can be deployed. And so those are on the list of things, for this next purchase of pallet products.
Thank you for that, and thanks, Amanda and Maria, for the work on that. I love the portable pallet unit, shower unit that is being engaged in Cottage Grove. It's a trailer that is fully ADA compliant. They're more expensive. They last a lot more years, and I'm interested in the county acquiring some of those. But in the meantime, the pallet, particularly the shower houses, are of high interest to a lot of people. Thanks, Steve.
Yeah, and Aaron Fifield said in the chat that that Mainstream Housing has purchased the bathroom unit for their Springfield site. The other update, oh, excuse me.
Lucy Venice has the floor.
Oh, I just want to express my gratitude and excitement about all of these reports. I think the combined picture of where we're going in terms of the winter weather strategies, the navigation strategies, the safe sleep sites, the investment and outreach, and then these state investments in ARPA funds, this is just a huge amount of good work that is moving forward, and it's really, I hope, really going to change our sort of default setting on how we respond to this crisis of homelessness. So I'm thrilled with this whole report, and I just want to thank you all for your role in it.
Thank you, Madam Mayor. Steve, let's do 2 minutes, and then we'll open up public comment, please.
Okay. Yes. So in your packet, also the last page of the packet has an organizational chart for the Human Services Division. Just to give you an update, we have Kate Budd, who is coming to become the program manager for housing and homeless services. And she's arriving on the 29th of this month. And so she'll be available at our next THB meeting, and I'm hopeful that she'll have an opportunity to meet members of both the executive committee and the the whole board along the way as she onboards. And again, she's been the executive director of the Council on Homelessness in Vancouver, Washington. And so she comes to us with a lot of experience with the same funding sources. She also worked with Clark County with their anti-poverty and homeless programs. And then the other member of staff who just came to us is Hillary Moran, and she took the position that Alex Dreer had, and she is on a career development rotation as we are posting the position. And she comes to us with quite a bit of background working in our workforce programs, and most recently working on workforce programs with folks who are wildfire survivors. And also during the COVID pandemic, she has done all the work with employers who have been impacted by COVID-19. So those are my updates. Thanks, Chris.
Thank you very much, Steve. Looking forward to meeting the new staff and seeing where we go. And thanks for your leadership on this and helping recruit good people to the department. With that in mind, I'd like to open up the public comments. We have Richard Self in queue. Anybody else, as Amanda asked, please put your name in the chat so we can have you go through. Please keep your comments to approximately 3 minutes. Thank you. Richard?
Thank you, Chair. Thank you, committee members. I would like to echo the mayor's comments. I am happily surprised to hear all of this going on and how it's marching up the level, and how you folks, especially Sarai and James, talking my language when it comes to the COC process and actually changing it so it works for the people that we're serving. So I am very happy to hear about that. And the idea that when we're doing future system mapping of what we're going to do, changing the system while we're doing it for the better is something I'm very much into. So I'd love to be part of your committee, James. And also, I wanted to say that I was very surprised to see the giant pallet shelter type things that were donated for at least the winter. I don't know if that's what you were and Mr. Farr were touching on earlier, but those are impressive with a kitchen in them, bathroom, laundry facilities possibly, and the smaller but large ones that can hold up to 6 people. Those are impressive. I'm liking what I'm seeing and hearing, and how we're going to go do this. So I'm very impressed. I think the street outreach, if I may, should in some way, in a very condensed version, be telling folks that they're reaching out to what's being done on their behalf, because a lot of them are very uninformed of what's happening. And also having a point A contact, whether it be at the upcoming resource center or what have you, would serve to help things. There is a gentleman right now in Washington Jefferson Park that's camped out and is homeless, and he's a victim of the Holiday Farm Fire. Lost everything. Proper outreach and proper point A for somebody to know where to go to reach out. This person may be able to take advantage of some type of shelter rather than be camping in the park. So, but I'm very impressed and very happy with the language I'm hearing and seeing here. And I yield.
Thank you very much, Richard, for your comments. I want to echo, I'm really excited about the next steps. Is there any other members of the public who would like to speak? Hearing none, I'd like to invite members of this committee to put forward items for the next executive agenda. And let's see here. In the chat, Lisa just posted an update to the Tableau, including acronyms. So feel free to click that link and share it with your individual jurisdictions and organizations. I want to, as chair of this committee, just want to thank all of the staff who have made the work going forward possible, those who have been before and those who will come after. I'm thankful very much for an active and creative Human Service Division and the related city and community counterparts. This is a community effort. This is something that is going to take a lot more of the continued demonstration of coalition building, of collaboration, and of hearing the people who are in need and building so that they can get back to where they can succeed. And so with the coordinated entry, with the incident response, and with the elements of covering basic human needs, such as showering, hygiene, laundry service, food, access to warm, safe sleep sites, and knowing that it's not going to just be tied to the activations of winter extremes. So very, very honorable work. We have a lot more to do, but this committee and the greater committees throughout are going to help ripple through. So to echo Vice Chair Farr's comments, other people are watching, and it's not just the communities that are coming to see how we do it, but also the people who are looking for hope. And so the sun's come out a little bit right now, so let's see what we can do with it. So thank you very much, and feel free to reach out if you have any other items. At this time, I will call this meeting adjourned.